Hello, this is Dr. Kevin Connors, and this video is going to go over just some frequently asked questions that we get at sometimes at the case review consultation. Sometimes we get it over the telephone. So I want to clear up some things just so you feel settled about what we do here and how this might fit into your health picture. So, first question that we get a lot is, do you treat cancer? Well, of course, we're a cancer clinic, quote unquote, but the answer is no, we don't treat cancer, and I make that emphatically clear in our my book as well. And there's some medical legal reasons why I say that, but there's some realistic, maybe a different understanding of what we're actually doing to try to take care of our patients. So, from a medical legal standpoint, only your oncologist can treat cancer. We don't treat cancer in our office. We're not trying to cure anybody, we're not treating disease. We're trying to take care of the patient. And our belief stems from a core value that the reason why we get sick is that there's something else going wrong with us. And cancer is just an expression of that something else going wrong with us. That's why we have those four pillars of care. We're looking for the cause, then looking from a nutritional, specialized nutritional standpoint of how we're going to work on that whole piece, and then using some instrumentation and some other things that will just help bring it all together to give you the best opportunity to fight whatever disease that you are diagnosed with. There's just too many things going on. We need to look at diet, we need to look at a spiritual, psychological point of view, different toxins that have affected you, different drugs that are affecting you, your microbiome, the gut flora that's affecting you. So there's a lot of different pieces to the puzzle that we, from an alternative standpoint, take that your standard oncologist um, literally has to ignore. You have to forgive them of that. They are too busy in their system to address these things. It's just not even possible, even if they were educated in this thing. Let's just be honest. I'm not educated in standard oncology, so don't ask me whether you should take cisplatin or another chemotherapy. I mean, that is your oncologist's decision. And my assistance for you is to look at all the other things that are going on in your body so that we can clean you up to make you be able to take care of this disease state as best as you possibly can. And it will help make your chemotherapy and your radiation or whatever else you are choosing to do at the same time to work much better. And that's really what our goal is. That's really what integrative care is. Another question is, why don't you speak of a cure rate? Well, the reason is because we don't cure anything. And I have a big argument with even an oncologist telling a patient after, so many rounds of chemotherapy and radiation or whatever they're going to do, saying that, great, you are cancer free. I think that is a misnomer. And you can argue, well, that's giving them a sense of optimism. But the truth is, it's just not real. There's nobody that's cancer free. Even if you're not even diagnosed with cancer, you have cancer cells inside of you, and your immune system is either winning that battle or it's not winning that battle, and that's what's going to give you a diagnosis of cancer or not. So to tell somebody that they're cancer free is really just dishonest, because if you've ever been diagnosed with cancer, you always have the cancer stem cells or circulating tumor cells in your body, and that's where these poor individuals 2 years later say, oh my goodness, it came back with a vengeance. Well, the truth is, it never went away. And if you approach it from the standpoint of just being a realist and say, okay, I have cancer, I'm going to do the things that I need to do to get myself into remission so that this is no longer a fatal disorder in my life, so that now it becomes a manageable problem, that I'm going to work on my diet and I'm going to work on nutrition, and I may choose to do chemo and radiation and such, but now I'm going to manage it for the rest of my life and hopefully die of old age in 40 years. So that's really what our goal is. Unfortunately, the medical system has manipulated a lot of things, and they go by what's called a 5-year survival rate. Well, that's part of their issue in trying to get early diagnosis of cancer, because the 5-year survival rate clock starts at diagnosis. So if we can make you live 5 years, you are legally, technically, quote unquote, cured. Well, that's just ridiculous. You could die a day after 5 years ticks by, and you still are going to go down in the annuals of their cure rate as a 5-year survival, a cured person of cancer, and you died a day after your 5-year survival rate. Well, that's just ridiculous. That's called manipulation of statistics. I don't think that's fair to patients. I don't think that's honest when you're trying to prove that your efficacy of your treatment by using those numbers, they're rubber numbers, and it's just dishonest. So we don't use anything like that, besides the fact that we're not, quote unquote, treating cancer. We're not looking for a cure. We're trying to get you to survive and to thrive and to live happily and to live without a ton of side effects of whatever other treatment that you're going through. That's our goal in your care. We're coming alongside you trying to get you to experience this and have it not be such a horrific experience going through your treatment. Another question we get is, well, if this works so well, it sounds so good, how come everybody isn't doing it? You know, it sounds so great. Well, there's several reasons for this. Number one is it doesn't work so well. This isn't magic. So, yeah, we have most of our patients that have ever come to see us are still alive today. But I'm not taking any credit for that. It's your body healing. And it's the other therapies that they did too. Most of our patients have done chemo, radiation, and surgery, or are doing it at the same time, or whatever. So we're coming alongside their other care team in order to team up to help them go through it better. Well, it seems like this alternative addition to care helps a person live longer. Again, people ask this question: why isn't everyone doing it? Well, I think the biggest reason is fear. And partly ignorance. People just don't know about it. Here, you're watching this video, so you either found it on Facebook or you found it on YouTube or you're at our website watching this video and you're seeking out some alternative additions or solutions to your problem. And that's fantastic. But the majority of people don't. When you hear cancer in a diagnosis, let's be honest, you're scared stiffless. And most people get herded down the standard oncology pathway without really feeling like they have time because many times they're told they don't. They have to do this right now. We're starting you with chemo on Monday and we're going to do surgery, 3 weeks later or whatever the thing is. You don't really have time to think. It's hard to digest that big giant word called cancer when you're in a state of panic. So when you have that terror in your heart, you're not thinking of other things. And it's really easy to put that responsibility on your oncologist to get me better now instead of saying, hold on, I'm not giving responsibility to my health to anybody. I'm taking that back and I'm going to investigate this and think about this. And I may choose to do some standards of care, but I may choose to add or to supplement other things as well so I'll have a better outcome. So everybody doesn't do it, but I'll tell you right now, it is growing all the time. This is a 2007 statistic that 38.3% of adults in the U.S. are using complementary therapies. It's not just cancer therapy, but other complementary therapies. It's so much lower with children because legally you can't just rush your children to an alternative cancer clinic without making sure that you're still following standards of care because legally your children aren't your possession. Your children are the possession of the state. Unfortunately, people don't realize that until they get into the situation of that. But when we talk about adults, there is a growing group of people that are seeking out alternative care. We are swamped in our clinic all the time, and it's a great thing, and it's great that people are exploring other options. And I realize too that there's no possible way we could take care of all the people that call us. That's why we have these videos. That's why we have our website that I'm constantly adding information. That's why I don't play golf. So I can constantly add information to help people that would never be able to come to us. So that is our goal, so that I can leave a legacy. That's my desire, to leave a legacy long after I'm gone, that people can use this information to help them or their loved ones. So people are using it, and it is a giant growing trend. Another big question, people don't think that they can add complementary alternative therapy to their standard approach, and that is horrible, because when you add complementary therapy, the therapies that you'll see on this website, to standard oncological procedures, you're going to go through those standard procedures much better, in my opinion. And that's based upon my experience. People that are doing alternative therapies while they're doing standard oncological therapies go through those much smoother. If we can support your liver detox pathways, and we can do a genetic test to find out how your liver detox pathways need support, and then support those pathways, you're going to be able to go through chemotherapy and radiation much more successful. If you're using a Rife machine, that can help even target your chemotherapy. So that is so much more effective. You're going to get better benefits out of it. So absolutely, you can add this to your standard of care. That's really what integrative cancer care is. Integrative cancer care is that you have multiple um, helpers through your problem. I think one of the greatest mistakes any person can make with their health care is to take a dogmatic approach. And I've said this 100 times before. When you take a dogmatic position in anything, your mind is made up. You've already made your decision. It's done. I'm going to follow exactly what my oncologist says, and that's all I'm going to do. I'm never going to go to an alternative doctor. Well, you're going to have a limited success. But I also think you can be dogmatic the other way. No way, I'm never going to an oncologist. I'm only going to go to an alternative doctor. I'm never going to do surgery, chemo, or radiation. I think that is equally as foolish. You need to have, the Bible is very clear. There's wisdom in a multitude of counselors. You need a lot of people to be adding to your piece of puzzle. And it doesn't mean you necessarily choose not to do an integrative approach. That's fine. Or you choose not to do standards of care. That's fine. But you have to be open to it and investigate it. And obviously, you're watching this video, so that's the position you're at. Another question is, when is the best time to start alternative methods? We get this a lot. People on the phone with me say, well, I found out I have cancer. I guess I really want to do this meaning, an alternative approach, but I'm going to wait till I finish chemo. Um, that's fine, but I'm just telling you my opinion. The alternative approaches will help you go through chemo much better. It will help target chemo. It will help pull it out of your body. You'll have less side effects. So the best time to start ultimately has got to be your decision when you're going to start. But really, the best time to start an alternative approach is immediately. It doesn't take the place necessarily of standards of care, but it's going to really help you go through that much better. So ultimately, our desire is that you seek God's will on what you should do. Um, don't be afraid. If you're a believer, make sure that you get on your knees and pray, and then just listen, and just be quiet and listen and say, God, you know my heart. I don't want to have cancer, but you've allowed this in my life for some reason. I don't know why. People ask me this question all the time. If you got cancer, would you do chemotherapy? And the answer is, well, God knows me. He made me. He created me. He knows I don't want to do chemotherapy. So that would be my prayer. Lord, you know I do not want to do chemotherapy, but please change my heart if this is the path you want me to go. And so it may be with you. Maybe you're more afraid of alternative therapies. Well, get on your knees and say, Lord, what should I do? And we certainly don't want people coming to us because they're just scared spitless and they don't have any other options. We want people coming to us because they feel led, because they feel like they're walking in wisdom, because they feel like they sought out answers and they spend time investigating and they weighed out their decisions. should I do this or should I do this? Well, this has this advantage and this has the other advantage, and here's some disadvantages and here's some positives. Lay it out. Get out a piece of paper and draw the pros and cons of your decision making process. Always, I beg you to understand you have more time to make your decision than anybody else tells you to. Don't let me, don't let your oncologist, don't let somebody else scare you into making a decision based upon fear. The worst mistake you could possibly make. Probably one of the most common comments I receive from a patient is the comment that I wish I would have blank. Maybe I wish I would have waited to start chemo, or I wish I would have investigated this first. I wish I would have, whatever it is. You do not want to live your life with regrets. That's number one. So spend time, slow down, put the brakes on. I know you're scared, you're fearful, you don't know what to do. My biggest piece of opinion to you is just to put the brakes on and ask God, what am I supposed to do? Yes, maybe you're not going to hear this audible voice in the heavens part, but you'll know in the depth of your hearts, and you'll have a peace that passes all understanding of when you ask Him for wisdom, He's promised to give it to you. So do that, and just slow down and ask Him. That would be my biggest request from everybody. Our desire is to give you as personalized medicine as possible. That's what our desire is. I hope this little frequently asked question video helps you. Read the rest of the frequently asked question uh, the things that are typed out on this page as well. If you're not at the page and you're just watching the video off Facebook or something like that, go to our website, Connor's Clinic, and you'll find a whole bunch of information. And above all, spend a lot of time on our website getting as much information as possible so it helps you weigh out your decision. All right. Thank you so much. Know that we'll be praying for you. Bye bye.